Good evening, everyone. I'm Rakhi Gautam from greytHR, the moderator of Parichay webinar series. And a warm welcome to all of you for joining us on our 104th episode of this Parichay webinar series. Thank you so much for being here with us on this journey for so long and, always excited to share ideas, insights with you all. Now, today we will be talking about something which is very specific but very important, right? So, the topic for today, as you all can see, is rethinking HR in healthcare for a stronger workforce. And we will be delving into one of the most urgent priorities for India's healthcare ecosystem, which is building a skilled, agile, and patient centric workplace capable of supporting the next decade of growth in healthcare delivery. Now, before we get started into the discussion, let me just quickly take you all through the agenda. So the first part is the discussion with our expert panel that we had today here, followed by audience Q&A. So audience Q&A is where time is all yours. You can put your questions in the Q&A panel that you can see on your screen, and we will be taking them up towards the end. Also, this session is currently being recorded. So if you happen to miss out on anything, do not worry at all. We have got you covered as always. We will be sharing, the recording with all of you by next week for this session. Now, I think we have the quorum with us to get started. To set the context, right, as India's healthcare ecosystem shifts to digital care and patient-centric delivery, HR, of course, plays a vital role in building a skilled, agile, and future-ready workforce. With over 6 million professionals today and 6.3 million more jobs projected by 2030, according to IBEF 24-25 report, capability building at scale has become essential. HR must now drive skilling and reskilling, redesign roles for new care models, and leverage analytics and HR tech to strengthen clinical, allied, and home care teams. And to unpack all these priorities, we are joined by three distinguished healthcare and HR leaders today. Ms. Indrani Chakraborty, Vice President at WICCI Kolkata and co-founder NurseIndia. Mr. Gopala Krishna Mantha, Head of HR Apollo Home Healthcare Limited, and Dr. Amit Singh, Chief Human Resources Officer at Care Hospitals Quality Care India Limited. Let me quickly take you all through their profiles. Indrani is a seasoned HR and communications leader with over 20 years of experience driving capability transformation across the Aditya Birla Group, Tata AIA, and the CK Birla Group Healthcare. In her current portfolio, she supports organizations through HR consulting, leadership development, and digital capability building. As Vice President at WICCI Kolkata and co-founder of NurseIndia, she works at the intersection of growth, inclusion, and purpose-led workforce development. Thank you so much for joining us today, Indrani. It's a pleasure to have you here.
Likewise. Thank you for having me over.
Thank you so much. We are also joined by Mr. Gopala Krishna Mantha. With nearly 2 decades of experience in HR, Gopal leads talent strategy, culture building, and digital HR transformation at Apollo Home Healthcare. He's known for designing high-impact people practices that strengthen workforce agility and business alignment. His expertise spans talent management, employee experience, and organizational development, with a strong focus on using technology and data to build scalable, future-ready teams in the healthcare ecosystem. Thank you so much for joining us today, Gopal. It's a pleasure to have you.
Thank you so much.
Moving on, we are also joined by Dr. Amit Singh, Chief Human Resources Officer at Care Hospitals. Dr. Amit is an accomplished HR leader with over 20 years of experience across healthcare, consulting, IT, and global operations. At Care Hospitals, he drives people strategy, organizational development, and leadership effectiveness across multiple regions. A certified results coach and an alumnus of IIM Kolkata and the Rotterdam School of Management, he specializes in transformation, M&A integration, culture building, and capability development for large, diverse teams. Thank you so much, Dr. Amit, for joining us. It's a pleasure to have you here as well.
You're on mute, Amit.
Thank you, Rakhi. Thank you for having me, and pleasure to join a very good group of friends and colleagues.
Great. Thank you so much, everybody. And let's have an exciting session today. And to our audience as well, keep those questions coming, keep the engagement high, keep giving us those reactions whenever you like a response. And if you would like, you can always share your experiences in the chat as we, discuss on the crucial aspects of redesigning HR in healthcare industry. Now, to start off with, Indrani, let me start with you. Healthcare delivery is evolving rapidly, right? With digital care, telehealth, and home based services gaining prominence, right? So, from your perspective, how is HR rethinking skilling, role redesign, and capability building for nursing and frontline teams to support these emerging care models?
Thank you, Raki. Uh, in my role as co-founder of NurseIndia, as we speak to a lot of healthcare leaders, nursing leaders, HR leaders working in healthcare, I think two or three spaces are emerging clearly as, areas which are really ripe for shift or ripe for transformation. Firstly, the organization design, the entire organograms. Traditionally, we've always built them around functional structures. That I think very clearly in the more evolved healthcare spaces, which have fairly trained and engaged staff, that is clearly moving towards care-based design. So you really have integrated healthcare teams all in one healthcare continuum journey. And again, like I said, that requires, however, very, very high levels of training and engagement. You cannot have an integrated healthcare care-based team that kind of seamlessly operates across hospitals, home healthcare, digi healthcare, unless you have a fairly sticky staff. So that's clearly one shift. The second shift, that's not too many places are doing, but I think that's a space which if we quickly gear up as HR leaders, as people who decide the organogram strategy, is this use of enabling technical roles or digital roles. It's sort of like so typically you see a slightly older nurse often struggling because half of a time, more than half of a time is actually going into inputting stuff on a software that she sometimes does not even understand, or a platform based. So in functions like that, which are largely clinical, so whether it's nursing or doctors, etc., if you have these digital enabler roles which act as bridges, then you can really leverage a lot out of your patient data, out of the healthcare, the HIS system that the hospital may have, without necessarily disrupting the clinical care piece or the clinical knowledge. So that really helps in building digital fluency while maintaining clinical knowledge. And I think the third piece is that's a shift we've seen recently, and it was a surprise to us as well, is training itself is moving from macro competency based stuff into micro skilling. Okay, so whether it's and this is regardless of experience. So we've had in my avatar, as in the Nurse India co-founder role, we've had very, very senior nursing leaders coming and asking us very specific requirements of, say, analytics in healthcare, or hey, how can I leverage chat GPT, etc. Similarly, for the junior levels, they prefer micro skilling on time, and not very generic competency based, large doses. They prefer, bite-sized doses, but very often. So those are three clear shifts that we've seen as healthcare is evolving, and it is evolving very, very rapidly.
Thank you so much for that, Indrani, and setting the context for this discussion today. And we do agree, I think, regardless of the industry today, technology is playing a crucial role, and it is where you go, right? It is everywhere, right? And it's important that as working professionals and as HR leaders also, that we are able to enable that technology for our workforce to use it, efficiently and to use it in the right way. And I do agree that, of late, there's also, of course, a lot of emphasis on micro skilling, right? Or skilling which are sort of designed for individuals and not looking at it from a group of people that should have a particular skill. And that always helps because that keeps that regular and continuous learning and development in mind while providing that. So Thank you so much for sharing this with us. And before we move on to the next question, I would also like to understand from the audience as to where do they see is the biggest capability gap in the healthcare workforce today. So let me launch a poll, and I would urge each one of you to participate. Again, polls, as I always say in these sessions, are to understand your perspective, are to understand your experiences, right? This is not a right or a wrong question. This is just to understand where you stand so that we as the panel today can also help you with your experiences and tailor our responses accordingly. So some only 10% of you have participated till now, so I would urge each one of you to participate and keep the engagement high. This will also help you understand the session more clearly. Okay, we'll wait for another 10 seconds and then I will end the poll. And each one of you, please participate and share your response in this poll. Okay, I will end the poll now. And thank you so much to everybody who participated in this. Let me also share this with all of you. Now, 44% of you chose digital care readiness as one of the biggest capability gap in healthcare workforce today, followed by closely 37% at behavioral patient experience skills, 11% as supervisory and mid-level leadership skills, and 7% as clinical skills. So thank you so much, everyone. And I think one thing that I can see by just looking at it is, we know our jobs, right? We know our jobs as experts in our own field. But then the new technology that's coming in, the kind of, reactions that you can or cannot expect from an external force is something that we need to be focusing more upon. So thank you, everybody. Let me move on to the next question. And let's hear from our expert as to what is it that they feel about this. So Gopala, bringing you in here, home healthcare operates, and I think this has become really relevant and prominent now. Home healthcare operates in a unique environment where clinicians, caregivers, and digital systems have to work together in sync, right? So how do we design competency frameworks that balance clinical proficiency with behavioral elements like empathy, communication, and in-home patient management that we also saw on the poll?
Yeah. So home healthcare is the care that is provided beyond hospital walls, which is very much needed nowadays. And then just like your Blinkit or Zomato is coming to your home, your health also is expected to be at home most of the times. And then we in Apollo, we are expertise in creating even critical care setup at homes. Now, what does it call for right now? It calls for a balanced clinical proficiency with behavioral competencies together. So one single approach will not work out. We'll have to have a blended approach, blended competency model, I would say. So the clinical skills, yes, it is very, very important one, along with behavioral skills, and then also the home care operational skills, right? So these things have to integrate with each other, and then we'll have to really emphasize on these skills for all our frontline staff who are catering to our patients. The second thing is moments of care mapping. What does it mean? It means we have a way of onboarding a patient. So from the time that we onboard the patient, the entire home care journey we need to have we need to capture in a particular way. Now, right from the entering the home and then interacting with the family and then giving what we can cater to and what we cannot do, and then documentation part, the escalation levels, all these things we have to capture, properly. Otherwise, any escalations and medical legal cases that are coming, we need to answer all of them. So we need to give the operational skill to the front line. It is not just the clinical skill anymore. Now, apart from that, the behavioral competencies that I was talking about are very, very important. Now, most of the times, you get a help in a hospital with a senior nurse or your doctor or nursing supervisors or your flow in charges, whatever. But here, you'll have to take care of your patients all alone. So you need to have that empathetic approach towards your patient there, right? And then communication becomes the key for you. and you have to explain the procedure in a very simple language, not scare people. If at all you are using different drugs or whatever, you have to take care of the people, and then communication becomes very, very important. So at the same time, of course, it is also important for the safety of my frontline. So for that, we also have assessments before onboarding the patient. We also assess the patient, how what kind of thing. And then, like Indrani was rightly putting it, the digital competencies. Now, gone are those days where you keep writing the case sheets on papers, and then you are digitizing everything. Now your remote monitoring tools. Recently we have launched remote monitoring setup where I can track all my critical care patient sitting in my head office, right? So we have remote monitoring system here, and then I know what is happening with my patient. Then I can communicate with my frontline caregiver, and then ensure that the right care is being given at the right time. If the need be, my doctor pitches in. So that kind of, so they have to be equipped with the digitalization process, and then if there is any escalation process that needs to be there, how to use their CRM, and then whether we are ready with the teleconsultation immediately. So all those things becomes very, very important, and digital competency is something that we cannot get away with, right? And apart from that, if I have to take the individual approach, now from the frontline staff point of view, what is there in for them in the entire journey? Now, they may say that, okay, if I'm working for a hospital, I may get a different skill set. So how do you ensure that I give them the skills so that they don't really feel that they are away from their the skill set? So I started taking up training is one of the engines where I can create a better frontline worker than, for example, I'm taking a nurse with a basic skill set. So can I make them an advanced care nurse or a critical care nurse by giving a training? So these things you'll have to ensure that entire frontline staff, when you're putting it in a home care, you'll have to take care of the entire thing as a holistic approach. That's what I feel.
No, definitely. Holistic is the word that I'm going to take away from, your response today, because yes, as much as we talk about, clinical skills that, all these frontline workers have, they're also, as we are evolving, they need to be digitally skilled as well. They need to have these, better communication skills. There has to be that regular communication which is happening. The patient is aware of, what the treatment is. The family is aware, and of course, there are always those, situations that just arises, right? So how do we deal with those? That is where, as you talked about, behavioral skills come in the picture. So as you said, it's a very holistic experience that we need to provide to the patient, as well as the holistic, training that we need to provide to our frontline workers as well. So all of that comes together, and they're able to provide the best experience, not just to the patients, but also to them as somebody who's there saving lives, making a change every day. So thank you so much for that, Gopal. Now coming to you, Dr. Amit, and adding to this conversation on the evolving skills that we keep on talking about, right? So we understood that digital competency, digital skills are something that we need to hone today, right? Whether we are in a healthcare profession or otherwise, it's very important that we know how to use technology in the right way for our workforce, right? So how are hospitals, right, and with your experience as well, bridging these digital skills and tech readiness gaps, especially for clinicians, nursing teams, and allied health staff working with different departments, from telehealth platforms to automation? How can we, or if there are any, say, trainings or the kind of initiatives that we should provide and make for them, if you can highlight on that.
Sure. Thank you, Raki. I think it's a great and a very relevant question in today's workforce in terms of how do we look at digital and tech-enabled. I'll take a step back. And today, when you look at the whole India ecosystem, I'll not take the global ecosystem, but when I take the whole India ecosystem, we almost have 80% literate. So we're one of the most literate sort of organizations in the world. We've moved our literacy levels, right, to it's almost 80%. However, Indians per se, when you look at the average, right, we are almost 35 to 40% digitally literate. Right? Now that's the gap, right? Because the literacy levels are not transforming into digital literacy, which is going to be the workforce of the need. And if you see, this is the workplace that will produce the future of healthcare or any other industry, right? Interestingly, we are a young population, right? So which means that almost 65% of our population is less than 35 years, right? Which is very young. So the opportunity is that younger people are able to adopt to technology, much easier, right? They have less fear. They have less biases towards technology. So my son adopts to technology much better than I do because I still believe that I still need to learn, right? Now, one mindset shift that we're trying to build, and we've got to build at India Inc. at large, is that technology is no more a specific skill. It's more like a behavioral skill. You keep doing it, you keep, getting better at it. However, you talk to a 50-year-old, he will tell you, I need to be taught on technology. Today, 12 years don't need to be taught technology. They practice it, right? Mm-hmm. It goes back to a very antique model in terms of, skilling anywhere that you look at. It's a 70, 20, and 10 model. 70% of the learning always happens, informally, casually, on the ground, right? Now, as a tech-enabled organization, are we talking about tech? The problem is that we're talking more in terms of revenue and EBITDA than the skills that are required, right? And there's a disruption. So today, what are we doing at CARE? And I think that's a very important mindset shift that we've been trying to create over the 18 months that I've been in this role. So first and foremost, we're enabling leaders to have skills to talk around purpose. Right? Now, while performance is important, revenue is important, EBITDA is important because you can't have a purpose, if you don't have a salary. Right? There's no conversation of purpose. So salary is important. But the question is, let's not restrict only performance conversations. Every performance conversation has to be linked with a purpose conversation. How often are leaders having those conversations? So I think that's a very, very important motivator, and we're trying to shift the needle. So for example, every review that we start with, we're trying to find out why are we doing this exercise? Why do we exist? How are these happening? And we're spending some quality time around thinking around these things, right? Today, my top leadership is talking about purpose more importantly than performance, because the people below them will get the performance if the purpose is aligned. So that's one. The second, I think we're also considering the whole use of these skills, especially motivation to learn something, is a very important part of it, right? And I think if people are motivated enough and they can draw linkage between the skill and the career outcome, one's most likely to adopt it. People are not able to correlate it. People will tell you, yeah, chai, but abhi nahi karna. When does somebody say this is not important, right? Is when he can't see the direct correlation of it. He doesn't understand it. There's not enough, literacy around it. So as HR teams, I tell them our job is not skilling because, only 10% can be formal skilling. 90% actually is on the job, right? Which you say 70% is on the job, around in the environment, 20% is from others, and 10% is formal learning. I've never understood that putting people in a formal learning or structured way can even change organizations. It's the whole culture is when you start talking about tech, when you start talking about what relevance it means to the consumer, when you start, people slowly start adopting, right? I'll give you a simple example. Today, 100% of my workforce is using a digital app and everything happens through there. Because not every nurse, not every doctor actually does have a computer system because we are a non-desk job, right? We're like a manufacturing organization that's in the hospital, it's not there. And 100% usage. So we are saying the quality of conversation that we are having digitally is going to be very important because that shows the proponent of adopting to other, digital or technology tools. So that's the second. I think third, very important, right? How are we holding people accountable to their learning and to development and to overall, in terms of what they contribute? So we call this the AMP model. AMP is for accountability. And if you're accountable, second is motivation, and third is purpose. And I've gone top down. Is if you build purposeful organizations, if people are inspired and motivated to do what they do. Third, there's higher chances of seeing this as being accountable. Now, we've done a pilot at one of our hospitals. We operate a group of 19 hospitals under the quality care umbrella. And we did a pilot. And we saw very distinct change in customer feedback and very distinct change in terms of the revenue outputs we have in one of our hospitals. When we said, let's begin this pilot in one of our hospitals, and we could find that test had produced positive outcomes, both in terms of skilling, etc. So there is test too around these, but I think it's very important that we consider these factors when we're looking at the larger scale transformation in organizations.
No, very valid, Dr. Amit. And I must say, the way you passionately talked about it also speaks volume, because we're talking about purpose, right? And it's important that as much as we talk about the relevance and the importance and the growing emergence of technology, it's also important how we tie it back to the individual roles and responsibilities. How are they going to be benefited from it? Or how are they going, why will I learn, like, to use a particular application? How is it going to help me track, maybe the health of my patient, or at different levels, how is this going to help? And when we're able to give that learning and give that responsibility, or if we're able to brief our individual employees as to, okay, this is how you're going to help create a difference, this is your purpose, and this is where technology is going to enable it all for you, this does help. So thank you so much for sharing this, and also all these experiences and the anecdotes that you're doing there at care also helps us understand the kind of impact that we can create if we know the purpose and the value that it is going to draw at the end of the day. So thank you so much for that, Dr. Amit. Now coming to you, Indrani, and taking one bit from Dr. Amit's response as well about of course there is that we need to scale bridge this digital literacy gap, but as he also talked about in the beginning, right, the younger generation, the younger people are able to adopt to technology in a much easier way than the old generation, right? And with multi-generational workforce teams together, working together in healthcare industry as well, uh, the clinical demands also keeps changing, right? So how do you ensure that the skilling programs, the reskilling programs that you are designing at your workforce remain engaging, remain interesting enough, remain sort of clear enough for all the generations to understand and cater to? So how do we ensure that whatever we are planning is not just relevant for the younger population but also for the older generation in the workforce?
Right, great question there, Raki. So, I'll actually go back about 7, 8 years ago when I was in an operational role as HR head for a hospital group, and I can tell you that 70% of my time and the nursing head's time, for instance, would really go into getting nurses to speak. Okay. It wasn't the clinical bits or the technical training that was an issue at all. They would really, lap that up. In fact, if you held a clinical session, etc., you would have them just attend it on their own. It was really in the, we used to call it how do you get them to emote and speak? And we actually used to joke internally that do we actually hold theater classes or filmy sessions to just get a nurse who was brilliant technically, okay, knew her job, but would just go zip in front of the patient. That was like, that was the challenge. So now when I'm on the other side and I'm interacting with the hospitals as clients, I've seen about 2 or 3 things that seem to work. These are, again, we're just trying them with clients, and we've seen some good results. One is multi-generational learning squads. Okay, that's the only, because you can't just keep teaching technology or keep teaching clinical. Okay, like Dr. Amit said, technology almost needs to become like a behavioral learning thing, right? It needs to be in the how of work. And that's where we've seen multi-generational learning squads really work well, where the younger force, help the seniors become more digitally literate or gain digital fluency around apps, around around just seeking knowledge from AI platforms. And the seniors keep pumping them with their skills and know-how, not just the knowledge, but it's the skills and know-how that how do you actually find the vein when it's not very evident. That is a skill that no classroom can teach you. You have to just keep pressing and get that, which is why one prick nurse is such a rarity in hospitals, right? the infusion champs and all of that. So multi-generational workforces, learning squads work very good when the leaders and the teams take responsibility for their own learning. So it's not really, a third function like HR or a learning and development team constantly they act as, enablers, system enablers, bring them access, give them access, put in the right experts in place. But it's really team driven and leadership driven, and learning is both ways. That's where mutual respect also comes. So that is something that really works well in multi-generational workforces. The second bit is, even for leadership and soft skills training, we've seen simulation. There's nothing that works like simulation. And by simulation, I mean, simulation is fairly common in the larger corporate hospital groups. It also requires a lot of investment. So we are not referring to high fidelity labs or, mid fidelity labs here with a lot of equipment and, simulation. Even in leadership and behavioral classes or soft skills classes, all you really need to do is, help the person, give him or her confidence and the know-how of how to handle a particular people situation. So what we've done, for instance, after we ran a couple of classes for a couple of clients, it was almost that, 80% of the situations are common. So we've now actually gone back and built a library of typical people situations that, let's say, a nursing leader or a ward in charge typically encounters. And what does one do in that situation? Now, mind you, we do not give out scripts, because then, it becomes very robotic. We do not do that, but we give out the situation. And typically all our classes are like across clients. So when you have, say, three people from Apollo and three people from Care and three people from, some other, I just took those names because my co-panelists are there from there. But when you see how people across the industry are handling those situations, you pick up a best practice here, you pick up a trick not to do, sort of a thing. But what you're providing is a very, very safe space for the nursing leader, along with an expert trainer or a facilitator present, to handle those very common people situations. So it could be, retaining a nurse, it could be a performance management conversation, it could be typically, handling a very strict doctor who's shouting at the nurse leader because of a nursing error somewhere or a medication error somewhere. So we've built a library of situations, and we see 80% of those pretty much play out across hospitals. And all we are doing is just providing them the first principles of the design. So, respect for the other, hear the other person, etc., etc. And then we allow them to just practice it. And next time when they encounter it in a real life situation, they are much better equipped to do that. So that's what I mean by simulation. And, ironically, as digital health grows, the need for soft skills grows even bigger. The need for soft skills, the need for leadership, empathy, just in it, there's almost a direct correlation with the growth of digital health and technology. And the third bit around your question on, how can redeployment become, effective for fast evolving clinical teams. I think that's a space which is just absolutely ripe for AI driven workforce design. Okay, so I mean, typically, at least in our times, just an enormous amount of manual time would go from the nursing leadership team. So here are your best nursing leaders who, instead of thinking strategically, are just grappling with rostering, because suddenly, some variable turns up, or one fine day you have a lot of admission. So this is AI can do this in seconds. So imagine you have a platform where you have patient admission data, patient acuity data. So it has to be acuity based skilling, manning. Okay, so patient admission, patient acuity, and on the other hand, you have staff skill category. You can have an ABC category, and staff leaves and staff attendance. So if all of those four data points are integrated, it's just a simple app that can just throw up the rostering for the day, which is linked to, so your best nurses are taking care of your most serious patients. So that's something that I think it's not very expensive. It's just a matter of putting in your rules that work for your hospitals in place and getting a back-end coding done. So those are some of the things that I think help in implementing these shifts as we go forward.
No, very valid, Indrani. Thank you so much for sharing this. And in fact, I love the idea of, simulations because uh, I think I, as an individual, and a lot of people would agree on this, is if we are given a situation, and that, this is the scenario and this is what you have to do, or what is it that you will do, tell us, right? When we do that, it helps us understand a lot of things. It broadens our perspective. And then when we encounter such situations in real life, right? This definitely helps us, tackle any challenges which are there better in a very better and a professional manner, of course. And then you also talked about how it's important to keep that learning alive and give that motivation to everybody that what, at my level, I don't need my leader or my reporting manager to tell me that what, you need to upskill yourself, or this is what you need to do. If I have that kind of culture in my organization where learning is of utmost importance, and there's a culture of continuous exchange of learning and ideas and experiences, people want to learn themselves, right? So that does help as well. And of course, you talked about artificial intelligence and the use of technology, and how we can now, with the infusion of technology, can focus a lot more on strategic experiences, strategic goals, rather than doing that manual task and operational bit. So thank you so much for this, Indrani. This really helps, and I hope everybody is taking notes in the audience. Now, coming to you, Gopal, and talking about the question, which I quoted in the beginning as well, right? That India is set to add 6.3 million healthcare jobs by 2030. Great number there, right? So, in this context of massive growth, how is HR? And I know the onus falls upon on HR every time there's any kind of disruption that happens in the world of workplace, right? So, how is HR preparing to address staffing gaps, and capability shortages, and especially in frontline and home care roles across diverse and distributed geographies? In India, for example, now let's restrict to India and see how we can, do that here.
I would say that is a very relevant question in the current context, I would say. Right now, healthcare is suffering from shortage of staff. Now, if I have to talk about especially nursing staff, healthcare is seeing 33% lesser than what it is supposed to have right now. So if you're saying that, okay, 6.3 million jobs are expected, at the same time, we need to also have human resources to cater to that kind of, ecosystem. Now, I'm not too sure how much government is going to really create opportunities for the people. Now, my worry also is that the younger generation are not willing to take up, especially nursing jobs as their career paths. That is one of the, things. Having said that, the healthcare has to run like this. So, especially in home healthcare, what I have done is the frontline staff is my product actually. So my company's product is service. So without my human resource, it will not happen. So 75% of my revenues are based on my frontline staff. They are not there. I'm nowhere in the business. Okay, but having said that, getting manpower supply is very, very challenging, especially in home healthcare scenario. So people prefer to join hospitals rather than homes because one of the biggest concerns is the safety for themselves, right? So that's isn't the choosing a career path in home healthcare. Of course, they started getting into this nowadays, but generally the preference is to hospitals or home healthcare. Having said that, what I have done is that instead of looking at what is required right now, I have planned for the next 6 months, rolling forecasts based on the business volumes that I'm anticipating, and also attrition, heat maps. So one is that. Second thing is I started engaging with all campuses. I have identified 5,000 plus campuses pan India right now. And I started actively engaging with almost 50 campuses. Now, there are two things. One, I need to have people for different categories like basic care, advanced care, and critical care. One, I have to enroll nurses with that kind of skill set from the market. Second, I have to build my own skill set within. Two things. So what I can do is that I can actually take basic care skill set from the colleges directly, and then I give them the skill that is required for the home health care with the training imposed on them for about 10 days or so. The second thing is slowly, depending upon their seniority and then their level of expertise that they are showing, I move them. There's an internal mobility that is being taken care of. So somebody has worked for about a year in a basic care. I can upgrade them to advanced care through a structured upskilling training program. And second thing is you'll have to instead of depending from the external hiring, you'll have to have internal skilling roles for these things, especially because the most of the time 90% of my hiring is based on what is available in the market as a fresher, right? So that is the third thing. What I started doing is that I started partnering with all skill councils, government skilling programs, and then paramedical institutes, and then community vocational centers, like your Dr. Reddy's Foundation, all these things. And then for the patient care, where I don't require the nursing skill as such, I started enrolling them into this program and started giving them training. So you'll have to find out all the things that are applicable to these things, and then ensure that we are giving the right care at the right time. One last thing what I have to emphasize is that just like how much I'm hiring, it is also important how much I'm retaining, because healthcare also sees a lot of attrition. Attrition in healthcare is huge when you compare with any other industry, I would say, especially home healthcare. So what we need to also emphasize is on the retention. Of course, some part of attrition is inevitable. You can't do anything, but at least if you are able to reduce by 20%, 30%, year on year, it is really great. So you have to solve their problems, especially if they have any safety issues there. My nursing supervisor goes in and ensures that there's no ambiguity in the patient's house. If there is any safety issue there, I don't even take the case. It's like that. So we have certain stringent protocols, because my frontline is very, very important. So when I'm giving my care, it is important to take care of my frontline staff there. So you give the safety, and then you give the nice hostel facilities, and then hygiene, because people from rural areas, they come and then try to do the jobs here. So you have to create a safe environment to even stay for them, right? Third thing is you give a safe commute to them. So there's a bigger chance for them to stay with all these things. So you have to take a blended approach, that you retain, and then you hire more, and then retain more, or lose less.
Now, very valid. Thank you so much, Gopal, for sharing this. And love that you're not just talking about the experiences that we need to provide to the patients, but also ensuring that the best experience, the best and safe environment is also given to our frontline, to our workers as well. So, because at the end of the day, that is the kind of experiences as an HR leader that we're also striving to achieve. So, thank you so much for highlighting. You spoke a lot about how there are a lot of jobs that are anticipated. There could be workforce shortages, but if we keep on giving those trainings, if we keep on giving them the right skilling, they should be able to and that would also create some sort of a motivation for people to also stay back, and we would be able to retain them. We also talk about the retention factor that is always there in the picture. So if we are giving them as employees, if I can use the word, as an employees, if we are giving them the right kind of experiences, they would also want to stay back and passionately work towards the common goal of the industry. So thank you so much for that, Gopal. Now coming to you, Dr. Amit, but before that, just a quick heads up to the audience. So this is the last question that I will be asking for the evening today, and we'll move on to your questions in the chat. So to you, Dr. Amit, we spoke about the kind of technological infusion that we are seeing today, and the rapid increase in demands as in the healthcare industry as well, right? And how we can provide great experiences to our workforce, do that skilling, reskilling, and keep giving them the right skill set, right? But as patient expectations also evolve and the quality of care benchmarks rise, especially after COVID, I think, how do we as an HR leader align competency frameworks, real-time HR analytics, that's where the technology part of it comes into, and performance systems to improve productivity as well, and ensure consistent care standards and are given to the patients, but also we are at the same time building a more agile workforce as a team. So how can we, sync that all up? And this would be like a conclusion to our discussion today.
Sure. I think that's a very broad question, and something that whole healthcare is played about is how do we bring in the effectiveness. So when you look at the whole, healthcare ecosystem in India, the evolution of the whole healthcare ecosystem has become more sort of formalized over the last 10 years. And there's a lot more work around the study of productivity. There's a lot more work around the study of performance, etc. So I think first and foremost, we have to understand that consumer expectations are changing. We'll also have to expect alignment of consumers' behavior in line with, what healthcare can deliver. So I'll give you an example, right? Today, with the growing loss of trust towards healthcare, right? Consumers very, very worried, saying, there's a rapid need for healthcare. But he's also very worried on the sanctity of what healthcare brings. So first and foremost, I think healthcare institutions have to work a lot more around building trust and competence around the whole ecosystem, and I think that's going to be a defining factor. While we are working on it, we also see the consolidation, bringing in large healthcare organizations together will bring trust in the name. And the consumer needs to start looking. Today, consumers want informed about everything. So the competence of healthcare was about treating the disease, needs to be about communication and treating the disease, right? So it has to change. The nature of interaction has to change from transactional to transformational. Because if I ask you, Raki, how many times have you got operated in a hospital? Probably it's once or twice in your entire lifetime. And I often ask people this, right? So it's not an everyday, interaction that you can be, transactional and say, you can come back tomorrow. It has to be transformation. And I think that's a very, very important part of this whole, healthcare ecosystem and transformation. Second, if you look at healthcare costs, about 40-50% of the healthcare cost is people costs, right? So the quality of workforce, when you look at doctors, nurses, and the enabling, there has to be a lot of change in the quality of workforce, because we don't have, organized programs, organized institutions that produce, hospital managers. We've had bankers, we've got technology, we've got IT firms, taking in, IT companies, etc. And they're massive intake, right? And today, if you look at last 5 to 10 years, the wage bill of a nurse has hardly risen. So organizations have got to be conducive of saying, how does this change? Because today, when you look at, nursing per 1,000 nurses, you're about 1.9 nurse, or maybe, short of 1.8 to 1.9 per 1,000. Whereas it should be ideally at least 3 nurses per 1,000. So this shortage is because maybe the institutions are not lucrative enough for them to have a starting career as compared to an IT or a bank or any other institution. So we've got to be cognizant to say, how do we equate this with equality, first in terms of payout and second in terms of respect, because both are important, right? So I think that will be important. I think even from the consumer lens, right, today, we still don't have awareness around the consumer. So for example, 20 years ago, our parents started taking life insurance, thinking that, just in case we die, our family should get some wholesome. Then came the trend of health insurance, which started in the last 10, 15 years, right? And health insurance still, if you look at the penetration, is negligible, right? Most of our hospitals run on credit businesses, government businesses, etc., etc. And I think the consumer, while they're getting informed, they're not responsible for their own, health. And I think that's an important mindset that the consumer has to change. That allows us to, help them, deliver more goods at hand, right? Also, our mindset, right? We still haven't started investing for healthcare, right? We plan to buy a house, we plan to buy a car, but we don't plan for an exigency. And if you look at Raki, what are the most frustrations? Any expense that is unplanned is very frustrating. Healthcare expense cannot be planned. It's an accident, right? And then suddenly this devastation breaks and hell breaks loose, and there's distrust and frustration. So it's an emergency service. There will be. I think we've got to start looking at how healthcare can handle some of those pieces of crisis, etc., which will require a harder skill, a much evolved skill, which needs to be paid much more than a normal engineer who's coding behind the screen. So once the society is able to bring some of those challenges up to equality of a nurse, I think we'll start seeing changes in that. Finally, I want to end this with some very, very interesting anecdotes around organization learning. And we spoke about this, right? Even till today, when you look at the whole spends in the industry, right? There's higher spends around graduation, higher education, kindergarten to 12, right? Very little nominal spend. It's less than 2 to 3% of total education spend on corporate learning, right? Some of those mindsets need to come back to organizations to start being able to spend more as compared to the Western counterparts that we have. And so once we have that, then you'll be able to build a more ecosystem that's more friendly with the consumer, and he gets what you want, right? And that's why it will be a big win-win both from the consumer and from the healthcare delivery perspective. And I think that's the ecosystem that you want, right? This lack of trust, this lack of one-sided ability of where, consumer doesn't trust the healthcare again then is frustrated because the consumer doesn't trust him. This is not leading with results. So I think we've got to build that accountability on both sides and I think work towards it. Those are my 2 cents. Very happy to talk about anything else that you believe is important. But I think some of these were very, very important for an ecosystem of healthcare and the consumerizing and awareness that we're seeing in the world today.
No, thank you so much for this, Dr. Amit. And, as you rightly said, it's not just the healthcare, but also as from a consumer point, perspective, it's important that we build that trust first within, between ourselves that, okay, this is where I'm going. I have to put my faith into the system that, they'll take care of me. At the same time, as organizations also, we need to provide good, of course, experience to the, patients, but also to our, healthcare staff that, okay, this is because you talked about how there's a lot of interest when it comes to IT profession, bankers and, engineers, but why is that not there for hospitality? And I think Gopal also did mention that we are now seeing a downward trend towards nurses, or, nursing students taking up hospital jobs because maybe the payout is not very great. Maybe this, the culture is not where they want to be at. So I think with this discussion also today and with all those insights that all of you shared, the meaningful, objectives that we spoke about, the purpose that we need to drive, at our workforce as well, is something that would also then motivate our healthcare professionals to stay, to be, there in organizations and providing the best experiences to the patients as well. So thank you so much to each one of you for, bringing your honest, your candid, your passionate selves to the discussion today. It was my pleasure to have this conversation with you today. And thank you so much once again. We do have some little time left with us, and there are a couple of questions in the audience Q&A that we'll take up, and then we'll wrap up the session. For those, in the audience, you can give me a reaction, heart, thumbs up, whatever you like this, not like that, any comments in the chat as well for us and our panelists to take this feedback today from. And if you have any questions, you can put that in the Q&A panel. I see a lot of you raising your hands. So in case there's a question, you can just put it there and we'll take it up. And thank you so much for all the thumbs up in the back end. Okay, so there's one question which is, and I think, we do see this a lot. This is from an anonymous attendee, but as doctors are considered gods, right? How do you deal with them as HR to maintain the culture of the organization? How do you align it? So, I think Gopal was answering this. Maybe you would want to take this one up, Gopal.
Yeah, I answered it saying that so you start with them with the respect. When I was working with Narayan Hridayalia, I'll tell you an incident. Doctors never used to punch. That's when we have introduced the biometric system there. Till then, people used to come and people used to go. And one of the doctors have asked, why are you not punching? Why should I punch? Every day I'm coming. Okay, so they saw it as that we are tracking their movements and other things, which generally doctors don't like. And then I said it's nothing about doctor, but it's all about capturing your attendance, and then the number of people headcount is growing day by day, and it's very difficult for me to really anchor to the attendance part. So it is important that we have to digitize this process. And finally, if you need to know that I need to whether I'm coming or not, so I'll only punch in. There's no punch out. There's only so I said fine. See, as long as you are giving me some information, I'm fine. So there is a policy also that we need to punch in and punch out, see whether the number of hours the doctor is spending in the hospital or not. But the conversation that comes up again is that, are you going to pay me extra when I'm spending extra time with you? Right? So you have to balance out these kind of conversations. So start with respect. See, getting a doctor degree is not that easy back here. So they have spent enough time, and then definitely, they come with that kind of, mindset that I'm a doctor, right? So that's okay. Let them live with that kind of this thing. So you start with respect. And then nowadays, doctor also, feeling the need for the soft skills and then the way that they need to handle the patient or other leaders in the ecosystem. So what we have tried doing is we have emphasized on the soft skills part for the doctors. And I know a story from US where suing the doctors is very, very common in Western cultures. Of course, not in the Indian context. So around about 10 years back, there was a survey that has happened on why 53% of the doctors are being sued, and then why not other 47 is not being sued. There's a survey that has happened. The interesting thing that has come out of this is that those people who have not been sued, they're not any different from other doctors that are available in the market. But these people have spent 5 minutes extra time with the patient to ensure that they are very comfortable. So they were very empathetic towards people. So people with soft skills who are managing their patients are not being sued in spite of the different outcomes than the anticipated, right? So what does it talk about? It talks about how you need to behave in the ecosystem. So what I have tried doing with the doctors is that you set non-negotiables with the doctors, they are okay to listen. Instead of taking a competitive approach, take a collaborative approach, right? So put them into your ecosystem, say that you are integral part of the system. So then people will love, giving the results that you wanted.
No, definitely. And I think at the end of the day, learning doesn't really stop, right? So we do have, and we discussed it in various touch points today, that where we are great at what we do, we have all the clinical expertise, but it's always those moments of empathy, those moments of communication that we have with our patients that always do the trick and make them comfortable. And yes, doctors are considered, especially in India, are considered gods. But then at the same time, I think we could be those what is it called? Some angels that come out of nowhere as HR leaders and tell them, okay, maybe this is what we need to do right now, and guide them. I think that's
Yeah. So I have a thought on that.
yeah.
I think first and foremost, the nature of the employment that India has is typically a doctor over the years has come to the clinic as a hero and walked out. He's not a part of the team.
Right.
So imagine a player who comes in just to play and gets out after the play. Right? I think what we need to redo is look at the engagement with the doctor is how inclusive are we? Today, we're beginning to have those conversations and saying, while your treatment is good, how do you think the hospital should run? Right? And today, a doctor is much more inclusive than what he used to be 10 years ago, because earlier he would just come, do his job, and go. Now, imagine a family member, if I had a son who just came in, had a meal, slept, and walked out, and no contribution to the house, he's not a part of the house.
Correct.
So, to get him, how do I involve in every business conversation while he does the core job? So today we're having those meaningful conversations about saying, Doctor, what do you think of the brand? Doctor, what do you think of the kind of people that should be hired? What do you think of, XYZ outreach? Do you think that's the kind of practice we want to build? Do you think on adding? Moment you do that, I have seen the inclusive doctors completely change. Right? I've been privy to some different formats outside India in terms of healthcare. And it's far, far more inclusive than saying you should do this, you should do that, because it's part of one team. So I think that oneness needs to be brought in. And HR is largely responsible from moving from administrative to culture drivers. Is there inclusivity?
Definitely. Culture, moving from so the operations bits to building culture and be the building blocks of culture in an organization is what matters. And yes, I think bringing everybody together from the top leadership, from doctors, specialists to the nurse staff to everybody who's there working in the system together is what would make any organization, not just hospitals, be a great place to work at, and at the same time also provide the best experiences to our stakeholders as well. So thank you so much to both you and Gopal and Dr. Amit for this very meaningful answer. There's one question I think Indrani has already answered, but Indrani, if you would like to take this one up, since it's also so that the other audience could also hear about it. What is the role of HR technology in the healthcare specific industry, and if there are any tools that you are using that can help, and audience can take notes of that?
So, like I answered in my typed answer, I mean, the possibilities are limitless and evolving every day. But two immediate action areas that HRs can pick up on the go without really too much of need for investments, fresh investments, etc., quick and ready tools is one, you can have individualized learning pathways for your, at least for your key identified key employees, which are very, which are individualized and personalized. That's the key word. Okay, and that you can take the help of AI to do that. So you have your needs expressed by the employee, let's say in the performance management form. You have some feedback from the bosses, you have some feedback from peers or other functions, and then you patch all of that up, and you can either have a recipe, or you can just have a pathway which talks of it's almost like a medicine prescription. Doses, what's the intensity and at what frequency. And that's a frequency that has to work for the employee. So, we don't always know what are his or her situations at home, etc. So it has to be a pace that is good for both the organization as well as the employee. So that is one. The second bit, like I mentioned, is all of these tasks which are non-clinical and which take a lot of time manually. Rostering is one big thing, very important. Without that, the hospital will crumble. But it is also not exactly a hugely strategic thing once you set the rules. All of that should really be digitized like as early as yesterday. And you build in those rules of not just presence or absence of staff, but patient numbers, patient seriousness or patient acuity, and staff skill. Your best nurses have to be with the most serious patients. uh, so those have to be done at least in the front end patient facing roles. So
Right.
these two are clear areas that you can do, like pick it up now.
Definitely. Thank you so much for this,
Thank you.
Indrani. I'll just take one last question, and this is for you, Dr. Amit. I think you have already answered in the chat, but for the audience there, as an HR, how can you help the doctor, enable their skills? What kind of learning opportunities can we can as HR leaders can create?
So I think first and foremost, it's very important to identify what is the real and true learning need. Because doctors have a variety of learning needs. And interestingly, like all of us, right, we perceive that we have one need versus actual need is there. So one could be an organization need that's important. What does the organization think the doctor should be doing? And second, what's the doctor's aspiration itself? Right. If it's clinically, aligned, the doctor has aspirations. Of course, there'll be other peers, other people in the industry, other experts in the city that the doctor can be mentored by, etc. And I think this is where network of collaboration is important. So we are not competitors. If a doctor in a particular hospital is doing somewhere great surgery, how can my doctor come and learn from them so that as an ecosystem we grow? The second is if there are skills that the hospital needs, for example, practice building skills, and being more empathy. So some of those, if the doctor is given the opportunity to understand that this has a direct bearing on his practice or his capability or his reputation, I think is more important than putting the doctor in training himself. Right? So I think that's the most important. In my life, I've seen the best of doctors are doctors that are constantly focused on building their capability both as clinicians and as patient-centric, experts. So I think that's the fine balance that we have. And if we are able to diagnose that very well, the treatment becomes easy.
Definitely. Thank you so much for this, Dr. Amit. And I think with this, we are wrapping the conversation today. Excellent conversation, and it was such a pleasure for me to, have all of you here with us. Thank you so much again for taking out the time and sharing all those secret, success mantras with all of us. And we'll continue to, provide the best experiences to both our healthcare staff as well as the patients out there. And once again, thank you so much. We discussed upon a lot of things, from how HR can strengthen India's healthcare workforce through strategic scaling, through competency frameworks, to a culture building, mindset, right? So thank you so much once again. And to our audience as well, thank you so much for participating, asking those questions. This always makes the conversation a lot more interesting. And thank you so much once again for your time. Now, before we wrap up this session today, I just want to quickly announce about the survey that we're doing at greytHR, which is shaping the future of HR predictions for 2026. So all three of you are industry experts, and a lot of our audience are also HR professionals who have joined us. I would urge each one of you and request if you can take 2 minutes out of your schedule to scan the QR code which is there on the screen and participate in this survey. We have some 17 questions across 5 dimensions that covers about what is it that we can expect in talent management, to artificial intelligence in HR, to culture building in organizations. And it would be great to have your insights as well as part of this survey, because you will shape this the world of HR and the world of workplace in 2026 and beyond. So if you can take this survey, that would really help. But in the meantime, once again, heartfelt thank you to everybody who joined us on this session today. And it was a pleasure to have you here with us. And until we meet next time, keep those conversations happening, keep building, and keep being, champions of culture at your workplaces as well. Thank you so much once again. We'll keep the screen on. But in the meantime, thank you so much, everybody. Have a good evening ahead.